Thanks, Steve. Well, Americans are spending $5 billion a year on herbal supplements to try and help with things like fighting colds, warding off depression, and boosting memory. But new research shows not all supplements are created equal, and that some contain fake or dangerous ingredients. Shocking. So what is behind the herbal hoax? Are there any supplements you should be taking? So we're going to ask Fox News Medical 18's Dr. Marc Siegel just that. Good morning.
Good morning,
Doctor.
Elizabeth. Good to see you.
Good to see you, too. So overall, I know more and more people are taking herbal supplements to just feel better. Are there really ones we shouldn't be taking at all?
Well, I don't think you should be taking any without consulting your physician, because some of them have side effects with medications you may be on. Also, studies recently have shown that they may have impurities in them. You don't know exactly what active chemical you're getting. So if you're taking a supplement, you don't know exactly how much you're getting. It varies from one place to another. The National Institute of Health actually has a division now called the National Center for Complementary and Alternative Medicine.
Okay,
they've been studying supplements, and one after the other, they're finding the proof is not there.
Okay, so for example, I know that there were three that kind of came under fire, so to speak. Echinacea is something people take for colds all the time, right? St. John's wort and ginkgo biloba. Explain why these may be or should be used with caution, if at all.
Well, you know, first I would like to say that if it works for you, it may be okay, but check with your physician. So I want to give you that caveat, because echinacea is one where one large group says it works for colds or preventing colds. Another large group says no. The studies are conflicting on echinacea. I think we need more research on echinacea. Echinacea is basically fairly well tolerated, but again, can interact with other medications.
Oh.
So you want to be able to tell your physician if you're actually taking it to decrease your symptoms of the cold.
So is this something you should be including when you go in and talk about your doctor? You write down all the things you're taking. You should always say what supplements and vitamins you're taking.
Absolutely.
Right?
Every one of my patients does that.
What about ginkgo biloba? Memory?
Well, ginkgo biloba was recently studied in a large trial called the GEM trial, G-E-M, and it was found that it did not prevent Alzheimer's. And because it used to be thought that it helped prevent dementia. It has not been proven. Some people think that it actually improves thinking. But the problem is, again, it interacts with other medications. It can increase your risk of bleeding, and it can be bad for your stomach. So it's got side effects.
Okay.
And I don't really think the effect is prominent at improving your thinking, your focus.
St. John's wort was another one to just proceed.
That I really want to focus on, because in Europe, St. John's wort is used a lot for depression, and I think it really works somewhat or fairly well as an antidepressant. I'll tell you what the problem is and what viewers need to know. You can't take St. John's wort with other antidepressants, because then they maximize, they combine the effect together, and you get a super effect, and it can have a real big side effect.
Oh, my goodness.
So your thinking can get affected if you're actually taking St. John's wort and you think, all right, I'll add that to the antidepressant my physician prescribed and not tell him. You better tell him.
Okay, and so those are the things to proceed with caution. The things that you are recommending right now, again, I'm sure with consulting your physician first, flaxseed oil, red yeast rice. And is this biotin?
Right. I wanted people out there to know that I'm not against this, so they don't label me and say, oh, Dr. Siegel doesn't like herbs. You know what? I can like some of them some of the time. I think flaxseed oil really lowers cholesterol. And if you can tolerate it without a lot of gas, I think it's a great thing to take to lower cholesterol. Because a lot of my patients will say, I want to lower cholesterol, doc, but I ain't ready for a statin.
Okay.
Red yeast rice is another one which can lower cholesterol. It has a statin-like effect, but it is not the same thing as Lipitor exactly or Crestor. So you may be able to take red yeast rice, and it may help you lower your cholesterol. But again, check with your physician.
And biotin, a lot of women use
Some people say that biotin helps with hair growth. I'm gonna try it this morning.
My husband is too, actually. Doctor,
great to see you.
Thank you. Great information as always. Well.